Are you noticing more hair in the drain lately? Maybe your hairline isn't sitting where it used to, or your part looks wider than it did last year, and suddenly you're spiraling. Hair loss hits differently. For men, it feels like aging overnight. For women, it feels unfair, almost invisible, but deeply personal. You start Googling at 2 a.m., and one name keeps coming up: Minoxidil. But here's the real question: does it actually regrow hair, or is it just another lifelong trap? Today, we're going to break down why hair loss really happens for both men and women, and surprising science behind how minoxidil works, how to use it properly. Most people use it wrong. And the dreadshed no one warns you about: side effects, myths, and when to avoid it, and some natural and other medical alternatives if minoxidil isn't for you. Quick disclaimer: I'm not a doctor, this is just for educational purposes. Always consult a dermatologist or a professional before starting your treatment. So let's get into it. Before we talk solutions, we need to understand the problem. The hair doesn't just fall, it follows a cycle, the hair growth cycle. Every strand goes through 3 phases. Anagen, the growth phase. This can take years and last for years. Catagen, the transition phase. Telogen, the resting and shedding phase. At any time, about 10 to 15% of your hair is naturally shedding. But when that balance shifts, thinning starts. In men, the most common cause is androgenetic alopecia, male pattern baldness. This is driven by genetics and DHT, which is a byproduct of testosterone. DHT shrinks hair follicles over time. They produce thinner, weaker hair until eventually they stop producing hair at all. In women, female pattern hair loss usually looks different. Instead of receding hairline, women often experience diffuse thinning across the crown. Hormonal shifts are huge triggers: pregnancy, menopause, thyroid imbalances, PCOS, and because it's more subtle, it's often ignored until it's advanced. Causes that affect both men and women are telogen effluvium, triggered by extreme stress, surgery, illness, rapid weight loss; nutritional deficiency like that of iron, zinc, vitamin D; traction alopecia from tight hairstyles could also be a common reason. Here's the key: minoxidil works best for certain types of hair loss, especially pattern thinning. It doesn't fix nutritional deficiencies or autoimmune causes. Now let's talk about what it actually does. What minoxidil is and how it works. Fun fact: minoxidil was never meant for hair or hair loss. It was originally prescribed as a high blood pressure medication. Doctors noticed something strange was happening with the patients because they were growing hair. That was the side effect. And this side effect became a billion-dollar hair treatment. So how does it work? Minoxidil is basically a vasodilator. It widens blood vessels in your scalp. More blood flow means more oxygen and nutrients delivered to your hair follicles. But that's not all. It's also a potassium channel opener that helps hair follicles in growth phase, prolonging the growth phase. And here's something most people don't know: minoxidil has to be converted into its active form, minoxidil sulfate, by enzymes in your scalp. If you have low levels of this enzyme, you may not respond well. And that's why some people swear by it and others say it did nothing for them. What it ultimately does is it reverses follicle miniaturization, pushes resting hairs back into growth phase, prolongs the anagen phase, but it only works if you use it correctly. Let's cover how to use minoxidil correctly. There are two main forms. The solution, it's usually cheaper, contains propylene glycol. It can irritate the scalp. And the other option is the foam version of it. It's often better for sensitive skin. It dries faster, has lower irritation. Now, here's where most people mess it up. Apply it to completely dry scalp, not wet hair. Using it on wet hair increases systematic absorption, which increases side effects. Focus on thinning areas, specifically massage gently. Wash your hands immediately after, or you would see hair growth in areas where you don't want to see it. Let's compare 5% versus 2% solutions. 5% is a standard for men. Women can use 5%, but only once a day. Many dermatologists now recommend a lower strength to reduce risk of unwanted facial hair. Consistency is everything. Miss weeks, you lose momentum. Let's talk about the dead shed. The timelines are between weeks 2 to 4. You might shed more hair than usual, and it feels like a betrayal, but this is often a sign that it's working. Weak hairs are being pushed out to make room for stronger ones. So don't give up yet. The timeline would be between months 1 to 3, shedding, minimum visible change, months 4 to 6, early thickening. Within 1 year, you see peak results. But here's the catch. If you stop using it, any hair gained would shed within the 3-4 months. Minoxidil is maintenance, not a cure. Let's talk about some side effects and safety. Commonly, itching, redness, dry scalp. Women may experience facial hair growth if it drips on the face. Rare but serious side effects that have been reported would include fast heartbeat, dizziness, chest pain. These happen when too much is absorbed systematically. There's also an option of oral minoxidil. It can be more effective, but it increases risk of systematic side effects like fluid retention and heart strain. It should only be taken under medical supervision. Some alternatives and boosters for minoxidil. If minoxidil isn't for you, here are some options. Medical finasteride for men blocks DHT, often combined with minoxidil for stronger results. Spironolactone is used off-label for women with hormonal hair loss. Some natural options would include rosemary oil, which has reportedly shown similar effectiveness to low-strength minoxidil with less irritation. Saw palmetto may widely block DHT. Caffeine shampoos may improve circulation, but effects are modest. So here's the truth. Minoxidil is not magic, but for many people, it is powerful. It works best when you start early, you're consistent, you manage expectations, take before photos, track progress every 3 months. Hair growth is slow, but so is hair loss. So if you've tried minoxidil, tell me, did you experience the dread shed? And would you use it again? Let's talk in the comments. And if this video was useful, please give it a like. Thank you so much for watching.